Approach to hematuria. Hematuria, the isolated hematuria without the proteinuria, other cells or cast is often indicative of the bleeding from the urinary tract. The hematuria is defined as a 2 to 5 RBC per HPF and can be detected by the dipstick. A false positive dipstick for the hematuria, where no RBC are seen on the urine microscopy, may occur when the myoglobinuria is present, often in the setting of the rhabdomyolysis. Causes of the isolated hematuria: stones, neoplasm, tuberculosis, trauma, and the prostatitis. Gross versus microscopic hematuria. Gross hematuria with the blood clot usually is not an intrinsic renal process, rather, it suggests the post-renal source in the urinary collecting system. Diagnostic workup: a single urinalysis with the hematuria is common and can result from the menstruation, viral illness, allergy, excess, or the mild trauma. Persistent or the significant hematuria: on 3 urinalysis, a single urinalysis with greater than 100 RBC or the gross hematuria is associated with a significant renal or the urologic lesion in the 9.1% of cases. Etiology by age group.
If you're done, you close this upstairs, then you lock the door.
Okay.
Open this slide.
Okay. Etiology by age group. The level of suspicion for the urogenital neoplasm in the patient with the isolated painless hematuria by the non-dysmorphic RBC increases with age. The neoplasm are rare in the pediatric population and the isolated hematuria is more likely to be idiopathic. They are associated with a congenital anomaly. Hematuria with the pyria and the bacteria is a typical of the infection and should be treated with the antibiotic after the appropriate culture. Acute cystitis or the urethritis in the women can cause the gross hematuria. Hypercalciuria and the hyperuricosuria, they are also the risk factors for unexplained isolated hematuria in both children and the adults. In 50 to 60 percentage of the patients, reducing the calcium and the uric acid excretion through the dietary intervention can eliminate the microscopic hematuria. Microscopic hematuria. The isolated microscopic hematuria can be manifestation of the glomerular diseases. The RBC of the glomerular origin are often dysmorphic when examined by the phase contrast microscopy. Irregular shapes of RBC may also result from pH and osmolarity changes produced along with the distal nephron. Observer variability in detecting the dysmorphic RBC is common. Causes of microscopic hematuria: IgA nephropathy, hereditary nephritis, thin basement membrane disease. Causes of the microscopic hematuria: IgA nephropathy and the hereditary nephritis can lead to the episodic gross hematuria. A family history of the renal failure is often present in the hereditary nephritis. Patients with the thin basement membrane disease often have the family members with the microscopic hematuria. A renal biopsy is needed for the definitive diagnosis. Hematuria with the dysmorphic RBC or the RBC cast. Hematuria with the dysmorphic RBC cast and the protein excretion is greater than 500 mg per day is visually diagnostic of the glomerular nephritis. RBC cast form as RBC that enter the tubule fluid and become trapped in the cylindrical mold of gelled time horsefall protein. Even in the absence of the acidemia, this patient should undergo the serologic evaluation and the renal biopsy. Hematuria with the pyuria. Isolated pyuria is unusual since the inflammatory reactions in the kidney and the collecting system are also associated with the hematuria. The presence of bacteria suggests the infection, and the WBC cast with the bacteria are indicative of the pyelonephritis. WBC cast also may be seen in the acute glomerular nephritis as well as in the tubulointestinal process such as the intestinal nephritis and the transplant rejection.